Hi, this is Dr. Morris. We're going to be doing some Graston on a wrist here. Patient has agreed to do the video. So we're using the GT2 protocol here with the instrument. We're using this tool to basically come down and evaluate first by using a sweeping technique to find the adhesion and fibrotic tissue in the wrist. And this patient has been doing pretty well with this treatment, having less pain, and she's able to actually exercise and use her wrist more, which has been really a benefit. So once we find the areas of fibrotic tissue, we then of course get a little more specific on the fibrotic tissue, and we break up that tissue using the instrument here. And what we're using is what's called an emollient, which is basically a cream type material here that helps us glide across the skin, less friction, and of course creates a little less irritation to the skin. This is basically called the filleting technique. We're coming down the muscle fibers and tendinous junction here and just really kind of breaking up any fibrotic tissue around those tendons. Now we're going to go on the inside here. Feels a lot looser in there on this internal part. It's doing really well. We also can go near the retinacular tissue here, which is very good for carpal tunnel syndrome also. And what we do is we just loosen up some of that ligamentous material as well. So that's a basic concept of Graston on a wrist. Good. And then we'll do the anterior aspect of the wrist. Good. Excellent. Wonderful job.